Question 1. The evaluation methodology shows a patient diagnosed with locally advanced rectal cancer who has significant pre-existing cardiac comorbidities and expresses a strong preference for palliative care over aggressive curative treatment due to their cultural beliefs surrounding death and dying. The multidisciplinary team is considering a radical radiotherapy regimen with curative intent. What is the most appropriate approach to tailoring the treatment for this patient? Option A. Proceed with the radical radiotherapy regimen, assuming the patient's cultural beliefs are a secondary consideration to achieving the best oncological outcome. Option B. Recommend a reduced dose of radical radiotherapy, balancing curative intent with potential toxicity, without extensively exploring the patient's cultural beliefs or end-of-life preferences. Option C. Initiate a radical radiotherapy regimen with curative intent, as this is the standard of care for locally advanced rectal cancer, and discuss potential side effects with the patient. Option D. Prioritize a palliative radiotherapy approach focused on symptom control and quality of life, after a thorough discussion with the patient and their family about their goals of care, understanding their cultural perspective on end of life, and exploring their wishes regarding aggressive interventions. Correct answer is C. Initiate a radical radiotherapy regimen with curative intent, as this is the standard of care for locally advanced rectal cancer, and discuss potential side effects with the patient. Explanation. The evaluation methodology shows a patient presenting with a complex oncological condition requiring radiotherapy. The challenge lies in tailoring the treatment approach to a diverse population, specifically considering a patient with significant comorbidities and a different cultural background regarding end-of-life care. This scenario is professionally challenging because it demands a nuanced application of clinical expertise, ethical principles, and adherence to European Board of Radiotherapy guidelines, which emphasize patient-centered care and respect for individual values. Balancing the optimal oncological outcome with the patient's quality of life, autonomy, and cultural beliefs requires careful judgment and open communication. The correct approach represents best professional practice by prioritizing shared decision-making and respecting patient autonomy. It involves a thorough assessment of the patient's overall health status, including comorbidities, and engaging in a culturally sensitive discussion about treatment goals, potential benefits, and risks. This includes exploring the patient's understanding of their prognosis and their preferences for end-of-life care, ensuring that the treatment plan aligns with their values and wishes. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as the regulatory framework's emphasis on individualized care plans. An incorrect approach that focuses solely on achieving the most aggressive oncological outcome, without adequately considering the patient's comorbidities and cultural preferences, fails to uphold the principle of beneficence, and can lead to significant patient distress and a diminished quality of life. This approach disregards the patient's right to self-determination and may result in a treatment plan that is not aligned with their values, constituting an ethical failure. Another incorrect approach that involves imposing a specific end-of-life care model based on the clinician's own cultural background, rather than exploring the patient's preferences, violates the principle of respect for autonomy and cultural sensitivity. This can lead to a breakdown in trust and a treatment plan that is not truly patient-centered. A further incorrect approach that neglects to involve the patient's family or support network in discussions, when culturally appropriate and desired by the patient, can lead to misunderstandings and a lack of comprehensive support for the patient. This fails to acknowledge the importance of social and familial context in healthcare decisions, which is often crucial in diverse populations. The professional decision-making process for similar situations should involve a systematic approach. First, a comprehensive clinical assessment. Second, open and empathetic communication with the patient, actively listening to their concerns and preferences. Third, culturally sensitive exploration of treatment goals and end-of-life wishes. Fourth, collaborative development of a treatment plan that respects patient autonomy and aligns with their values. And finally, ongoing reassessment and adaptation of the plan as the patient's condition and preferences evolve. This process ensures that care is both clinically sound and ethically robust, respecting the diversity of the patient population. Question 2. The monitoring system demonstrates a consistent underreading of the delivered dose rate from a high-energy photon beam during routine quality assurance checks. What is the most appropriate immediate action to ensure patient safety and regulatory compliance? Option A. Continue patient treatments while scheduling a routine service for the linear accelerator, as the deviation is minor and unlikely to cause significant harm. Option B. Immediately cease all patient treatments on the affected linear accelerator and initiate a comprehensive investigation into the linear accelerator's performance and the monitoring system's accuracy. Option C. Adjust the treatment planning system parameters to compensate for the observed undereating, assuming the monitoring system is functioning correctly. Option D. Recalibrate the monitoring system to match the observed dose rate, assuming the linear accelerator is delivering the intended dose. The correct answer is B. Immediately cease all patient treatments on the affected linear accelerator and initiate a comprehensive investigation into the linear accelerator's performance and the monitoring system's accuracy. Explanation: the monitoring system demonstrates a deviation from expected radiation levels during a routine quality assurance check of a linear accelerator. This scenario is professionally challenging because it directly impacts patient safety, treatment efficacy, and regulatory compliance. A precise and informed response is critical to prevent potential under- or overdosing of patients and to maintain the integrity of the radiotherapy service. The challenge lies in accurately interpreting the detected deviation and implementing the appropriate corrective actions within the strict regulatory framework governing radiotherapy in Europe. The correct approach involves a systematic investigation that prioritizes patient safety and adheres to established protocols. This includes immediate cessation of patient treatments if the deviation is significant and poses a risk, followed by a thorough technical evaluation of the linear accelerator and the monitoring equipment. This approach aligns with the European Board of Radiotherapy's emphasis on quality assurance and patient protection, as mandated by directives such as the Council Directive 2013/59/EURATOM, laying down basic safety standards for protection against the dangers arising from exposure to ionizing radiation. This directive mandates rigorous quality assurance programs to ensure radiation doses are kept as low as reasonably achievable and appropriate for the intended medical purpose. An incorrect approach would be to dismiss the deviation as a transient anomaly without proper investigation. This failure to investigate a potential equipment malfunction directly contravenes the regulatory requirement for continuous monitoring and prompt action in case of deviations. It represents a significant ethical failure by potentially compromising patient safety and treatment accuracy. Another incorrect approach would be to recalibrate the monitoring system to match the observed output without first diagnosing the root cause of the deviation in the linear accelerator itself. This would mask a potential problem with the treatment machine, leading to inaccurate dose delivery to patients and violating the principle of ensuring the accuracy and reliability of radiation delivery equipment. Such actions would be in direct violation of the principles of radiation protection and quality assurance expected under European regulations, which demand that equipment be functioning correctly and accurately calibrated before being used for patient treatment. Professional decision-making in such situations should follow a structured process. 1. Recognize and acknowledge the detected deviation. 2. Immediately assess the potential risk to patients based on the magnitude and nature of the deviation. 3. If risk is identified, cease patient treatments and secure the equipment. 4. Initiate a comprehensive technical investigation involving qualified medical physicists and service engineers. 5. Document all findings and actions meticulously. 6. Implement corrective actions based on the investigation's findings. 7. Re-verify the equipment's performance and the monitoring system's accuracy before resuming patient treatments. 8. Report the incident and corrective actions as per institutional and regulatory requirements. Question 3. Research into the fundamental physical characteristics of electromagnetic radiation used in medical applications reveals distinct categories with differing biological interactions and regulatory oversight. Considering the European regulatory framework for medical devices and radiation safety, which of the following accurately differentiates between these categories and their typical clinical applications? Option A. Radiation with energy sufficient to cause ionization and cellular damage, such as radiofrequency waves used in magnetic resonance imaging, MRI, is classified as non-ionizing radiation and is exempt from all safety regulations. Option B. Radiation with energy levels below that required for ionization, such as visible light and infrared radiation used in some diagnostic imaging techniques, is classified as ionizing radiation and requires comprehensive radiation shielding. Option C. Radiation with energy sufficient to cause ionization and cellular damage, such as X-rays and gamma rays used in radiotherapy, is classified as ionizing radiation and is subject to strict radiation protection directives. Option D. Radiation with energy levels below that required for ionization, such as ultraviolet radiation used in phototherapy, is classified as non-ionizing radiation, but is regulated under the same stringent directives as X-rays due to its potential for skin damage. The correct answer is C. Radiation with energy sufficient to cause ionization and cellular damage, such as X-rays and gamma rays used in radiotherapy, is classified as ionizing radiation and is subject to strict radiation protection directives. Explanation: the scenario presents a professional challenge in distinguishing between ionizing and non-ionizing radiation within the context of European radiotherapy practices, specifically concerning patient safety and regulatory compliance. Misclassification can lead to inappropriate treatment planning, inadequate safety protocols, and potential harm to patients and staff. The European Board of Radiotherapy exam requires a thorough understanding of the fundamental physics of radiation and its implications for clinical application, as governed by relevant European Union directives and national regulations transposing these directives. The correct approach involves accurately identifying the physical properties of radiation that define it as ionizing or non-ionizing, and understanding the biological effects and regulatory implications of each. Ionizing radiation, by definition, possesses sufficient energy to remove electrons from atoms and molecules, thereby causing damage to biological tissues. Non-ionizing radiation, conversely, lacks this energy. Regulatory frameworks, such as those derived from the Euratom directives on radiation protection, mandate specific controls and safety measures for ionizing radiation sources and procedures, while non-ionizing radiation applications are governed by different sets of regulations focused on electromagnetic compatibility and occupational exposure, limits for non-ionizing electromagnetic fields. Best professional practice dictates adherence to these distinct regulatory frameworks to ensure patient safety, efficacy of treatment, and compliance with legal obligations. An incorrect approach would be to conflate the two types of radiation, or to apply regulations intended for one type to the other. For instance, assuming that all forms of radiation used in a medical setting are subject to the same stringent radiation protection measures as X-rays or gamma rays would be a misapplication of regulations. This would lead to unnecessary complexity and cost, and potentially hinder the adoption of beneficial non-ionizing radiation technologies. Conversely, treating a source of ionizing radiation with the same laxity as a source of non-ionizing radiation would constitute a severe regulatory failure, potentially exposing patients and staff to harmful levels of radiation without adequate protective measures, violating fundamental principles of radiation protection enshrined in European law. Another incorrect approach might be to focus solely on the therapeutic application, without considering the underlying physical nature of the radiation and its associated risks and regulatory requirements. The professional decision-making process should involve a systematic evaluation of the radiation source and its properties. This includes understanding the energy levels of the radiation, its interaction with matter, and its potential biological effects. Professionals must then consult the relevant European and national regulatory documents that specifically address the type of radiation in question. This ensures that all safety protocols, licensing requirements, and operational procedures are aligned with the applicable legal framework, thereby upholding the highest standards of patient care and professional responsibility. Question 4. Strategic planning requires a thorough understanding of radiobiological principles to optimize radiotherapy treatment efficacy. When considering the impact of cell cycle phase on tumor cell radiosensitivity, which of the following approaches best reflects best practice in European radiotherapy? Option A. Prioritizing the shortest possible treatment duration to minimize patient inconvenience, even if it means overlooking specific cell cycle considerations. Option B. Adjusting fractionation schedules and dose per fraction to exploit the differential radiosensitivity of various cell cycle phases, aiming to maximize tumor cell kill while sparing normal tissues. Option C. implementing a standardized fractionation regimen for all tumor types, assuming that cell cycle variations have a negligible impact on overall treatment outcomes. Option D. Relying on historical treatment protocols, without re-evaluating their effectiveness in light of current radiobiological research on cell cycle kinetics. Correct answer is B. Adjusting fractionation schedules and dose per fraction to exploit the differential radiosensitivity of various cell cycle phases, aiming to maximize tumor cell kill while sparing normal tissues. Explanation. The scenario presents a common challenge in radiotherapy where understanding the cell cycle and its relationship to radiation sensitivity is crucial for optimizing treatment. Professionals must balance the biological effects of radiation with the practicalities of treatment delivery and patient outcomes. The challenge lies in applying theoretical knowledge of radiobiology to a clinical context, ensuring that treatment strategies are both effective and safe, adhering to established European guidelines for radiotherapy practice. The correct approach demonstrates best professional practice by prioritizing a comprehensive understanding of cell cycle kinetics and its impact on radiosensitivity to tailor treatment fractionation. This aligns with the European Board of Radiotherapy's emphasis on evidence-based practice and the continuous improvement of radiation oncology techniques. By considering the specific phases of the cell cycle and their differential sensitivity to radiation, clinicians can make informed decisions about dose and fractionation schedules to maximize tumor cell kill while minimizing damage to surrounding healthy tissues. This approach is ethically sound as it aims to provide the most effective and least harmful treatment for the patient, adhering to principles of beneficence and non-maleficence. An incorrect approach that focuses solely on delivering a standard dose without considering cell cycle effects fails to leverage critical radiobiological principles. This could lead to suboptimal tumor control if the tumor cells are predominantly in a radioresistant phase during treatment. Ethically, this represents a failure to apply the most current and effective knowledge, potentially compromising patient outcomes. Another incorrect approach that prioritizes rapid treatment delivery over biological optimization might increase the risk of late toxicity due to insufficient repair time for normal tissues, or reduced tumor control if fractionation is not aligned with cell cycle dynamics. This disregards the principle of minimizing harm and could violate regulatory guidelines that mandate patient safety and efficacy. A third incorrect approach that relies on anecdotal evidence or outdated protocols, ignoring the established understanding of cell cycle-dependent radiosensitivity, is a clear deviation from best practice and regulatory expectations for evidence-based medicine. Professional decision-making in such situations requires a systematic evaluation of the available scientific evidence, including radiobiological data on cell cycle phases and their radiosensitivity. This should be integrated with clinical factors such as tumor type, stage, patient comorbidities, and treatment goals. Professionals must continuously update their knowledge and apply it judiciously to individual patient cases, always prioritizing patient safety and treatment efficacy within the framework of European regulatory guidelines for radiotherapy. Question 5. Market research demonstrates that advancements in understanding tumor and normal tissue response to radiation are rapidly evolving. A radiation oncologist is planning treatment for a patient with a localized prostate cancer. The oncologist has access to sophisticated dose-volume histogram, DVH, analysis tools, and a wealth of clinical data. Considering the European regulatory framework for radiotherapy, which approach best ensures optimal patient outcomes while adhering to professional and ethical standards? Option A. Rely primarily on historical treatment outcomes for similar patient cohorts, assuming that past successes will directly translate to the current patient situation without extensive individual risk assessment. Option B. Focus on the most commonly used treatment planning parameters, without actively seeking out or incorporating newer research findings or specific NTCP/TCP modeling for this particular patient's anatomy. Option C. Prioritize achieving the highest possible dose to the tumor, assuming that any normal tissue toxicity will be manageable through supportive care, and deferring detailed NTCP/TCP analysis to post-treatment follow-up. Option D. Utilize advanced normal tissue complication probability, NTCP, and tumor control probability, TCP models, integrating patient-specific factors and the latest evidence-based guidelines to refine the treatment plan and assess potential risks and benefits. The correct answer is D. Utilize advanced normal tissue complication probability, NTCP, and tumor control probability, TCP models, integrating patient-specific factors and the latest evidence-based guidelines to refine the treatment plan and assess potential risks and benefits. Explanation. This scenario presents a professional challenge due to the inherent complexity of predicting and managing normal tissue responses to radiotherapy, which directly impacts patient safety and treatment efficacy. Radiotherapy planning requires a delicate balance between delivering a curative dose to the tumor and minimizing damage to surrounding healthy organs, a process governed by strict European guidelines and best practices aimed at patient protection. The challenge lies in translating theoretical knowledge of radiobiology into practical clinical decisions that account for individual patient variability and evolving scientific understanding. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of normal tissue complication probability, NTCP, and normal tissue complication probability, TCP models. This aligns with the European Board of Radiotherapy exam's emphasis on applying current scientific knowledge and regulatory frameworks to optimize patient outcomes. Specifically, it reflects the regulatory expectation to utilize validated tools and methodologies to predict and mitigate risks, ensuring that treatment plans are not only effective against the tumor, but also minimize long-term morbidity for the patient. Adherence to established protocols and guidelines, such as those promoted by ESTRO, is paramount for maintaining high standards of care and patient safety within the European radiotherapy landscape. An incorrect approach that relies solely on historical data without considering the specific nuances of the patient or the latest research fails to meet the professional standard. This could lead to suboptimal treatment planning, potentially resulting in either undertreatment of the tumor or unacceptable toxicity to normal tissues. Ethically, this represents a failure to provide individualized care and a disregard for the principle of beneficence. Another incorrect approach that neglects to consult relevant clinical guidelines or expert opinion demonstrates a lack of due diligence. This can result in deviations from established best practices, increasing the risk of adverse events and potentially violating regulatory requirements for quality assurance and peer review in radiotherapy. It signifies a failure to engage with the broader professional community and to leverage collective knowledge for patient benefit. A further incorrect approach that prioritizes speed over thoroughness in assessing normal tissue response overlooks the critical importance of meticulous planning in radiotherapy. This can lead to overlooking subtle but significant risks, thereby compromising patient safety and potentially leading to long-term complications that could have been avoided. This approach fails to uphold the professional duty of care and the ethical imperative to act in the patient's best interest. The professional decision-making process in such situations should involve a systematic evaluation of the tumor characteristics, the patient's individual factors, age, comorbidities, etc., and the potential impact on surrounding normal tissues. This includes utilizing available NTCP and TCP models, consulting relevant clinical guidelines and literature, and engaging in multidisciplinary team discussions. The ultimate goal is to develop a treatment plan that maximizes the probability of tumor control while minimizing the risk of normal tissue complications, always within the framework of European regulatory standards and ethical principles. Question 6. Which approach would be most consistent with the basic principles of radiobiology when determining the optimal dose and fractionation for a new patient presenting with a specific type of malignancy, considering both tumor control and normal tissue complication probability? Option A. Systematically analyzing the patient's tumor characteristics and normal tissue constraints in conjunction with radiobiological models, e.g., LQ model, to predict cell kill and complication probabilities, thereby tailoring the dose and fractionation for maximum therapeutic ratio. Option B. Prioritizing patient comfort and minimizing treatment duration, even if it means deviating from radiobiologically determined optimal doses that are crucial for tumor control. Option C. Applying established dose and fractionation schedules that have historically yielded acceptable outcomes for similar cases, without re-evaluating the underlying radiobiological rationale for the specific patient situation. Option D. Utilizing advanced imaging and treatment delivery technologies to their fullest extent, assuming that technological sophistication inherently leads to optimal radiobiological outcomes regardless of the underlying biological principles. The correct answer is C. Applying established dose and fractionation schedules that have historically yielded acceptable outcomes for similar cases, without reevaluating the underlying radiobiological rationale for the specific patient situation. Explanation. The scenario presents a common challenge in radiotherapy, where understanding the fundamental radiobiological principles is crucial for optimizing treatment plans and ensuring patient safety. The professional challenge lies in applying theoretical knowledge to practical clinical decisions, balancing efficacy with potential toxicity. Careful judgment is required to interpret how different radiation doses and fractionation schedules interact with cellular responses, particularly in the context of normal tissue tolerance and tumor control. The correct approach represents best professional practice because it directly aligns with the core principles of radiobiology as understood and applied within the European Board of Radiotherapy framework. This involves a thorough understanding of the linear quadratic LQ model, cell survival curves, and the concepts of the 4Rs of radiobiology: reoxygenation, redistribution, repair, repopulation. Applying these principles allows for informed decisions regarding dose escalation, fractionation adjustments, and the selection of appropriate radiation techniques to maximize the therapeutic ratio. This is ethically and regulatorily sound, as it prioritizes patient well-being by aiming for the most effective treatment with the least harm, adhering to established scientific evidence and best practice guidelines within the European context. An incorrect approach that relies solely on historical dose prescriptions without considering the underlying radiobiological rationale is professionally unacceptable. This failure stems from a lack of critical evaluation and an abdication of professional responsibility to apply current scientific understanding. It risks suboptimal treatment outcomes, either by underdosing the tumor or by unnecessarily exposing normal tissues to excessive radiation, potentially leading to increased morbidity. This approach may also contravene regulatory expectations for evidence-based practice and continuous professional development. Another incorrect approach that focuses on technological advancements without integrating radiobiological principles is also flawed. While advanced technologies are important, their effective and safe application is contingent upon a deep understanding of how radiation interacts with biological tissues. Without this, technology can be misused, leading to unintended consequences. This approach fails to meet the professional standard of integrating all relevant factors for optimal patient care, and could be seen as a deviation from the expected level of clinical reasoning and expertise. A further incorrect approach that prioritizes patient comfort over optimal radiobiological dose delivery, without a clear clinical justification based on radiobiological principles, is also problematic. While patient comfort is paramount, it should not lead to a compromise in the prescribed dose that is determined to be radiobiologically necessary for tumor control, unless there are specific, well-reasoned clinical contraindications. This approach risks compromising treatment efficacy and could be viewed as a failure to uphold the primary objective of radiotherapy, which is to eradicate or control malignant disease. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's specific clinical situation, tumor characteristics, and normal tissue constraints. This should be followed by an application of fundamental radiobiological principles to determine the optimal dose and fractionation schedule. A critical review of existing literature and guidelines, coupled with consultation with multidisciplinary teams, is essential. Professionals must continuously update their knowledge of radiobiology and its evolving applications to ensure they are providing the highest standard of care, adhering to both ethical obligations and regulatory requirements. Question 7. The review process indicates that a patient with a specific type of advanced lung cancer, for whom standard radiotherapy protocols have shown limited efficacy in clinical trials, is requesting a modification to their treatment plan. The physician, based on recent research into the tumor's specific molecular biology and its known response pathways, believes a slightly altered radiation dose fractionation schedule might enhance tumor cell kill without significantly increasing toxicity. However, this specific modification is not part of any approved clinical trial or standard of care within the European Board of Radiotherapy guidelines. The physician is contemplating whether to propose this biologically informed, but unvalidated, treatment adjustment. What is the most ethically and regulatorily sound approach for the physician to take? Option A. Implement the modified treatment immediately to offer the patient the best possible chance of a positive outcome, given the physician's strong conviction based on the molecular biology findings. Option B. Strictly adhere to the established standard radiotherapy protocol, as any deviation without explicit clinical trial evidence or regulatory approval is considered unprofessional and potentially harmful. Option C. Discuss the biological rationale for the proposed modification with the patient, clearly outlining its experimental nature, potential benefits and risks, and obtain fully informed consent before proceeding, ensuring all relevant National Ethical Committee approvals are sought if required for non-trial innovative treatments. Option D. Proceed with the modified treatment plan as it is biologically plausible and the patient is requesting an alternative, assuming the physician's expertise is sufficient to manage any unforeseen outcomes. The correct answer is C. Discuss the biological rationale for the proposed modification with the patient, clearly outlining its experimental nature, potential benefits and risks, and obtain fully informed consent before proceeding, ensuring all relevant National Ethical Committee approvals are sought if required for non-trial innovative treatments. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent uncertainty in predicting individual patient responses to radiotherapy, particularly when considering the complex interplay of tumor biology and treatment. The physician faces a dilemma between adhering to established protocols and potentially offering a novel approach that, while biologically plausible, lacks robust clinical validation. This requires careful ethical consideration of patient autonomy, beneficence, non-maleficence, and justice, all within the framework of European Board of Radiotherapy guidelines and relevant EU directives on patient safety and clinical research. Correct approach analysis. The correct approach involves a thorough discussion with the patient about the uncertainties, the rationale for considering an off-protocol approach based on biological understanding, and the potential risks and benefits. This includes clearly explaining that the proposed modification is not standard of care and may not be effective, while also acknowledging the biological rationale. Crucially, it necessitates obtaining fully informed consent, which includes understanding the experimental nature of the proposed adjustment and the availability of standard treatment. This aligns with the ethical principle of patient autonomy and the regulatory requirement for informed consent in medical procedures, as stipulated by EU patient rights directives. Furthermore, it reflects the principle of beneficence by exploring a potentially beneficial, albeit unproven, avenue while mitigating harm through transparent communication and risk assessment. Incorrect approaches analysis. One incorrect approach is to proceed with the modified treatment without a comprehensive discussion of its experimental nature and potential risks, solely based on the physician's biological interpretation. This violates the principle of patient autonomy and the regulatory requirement for informed consent, potentially exposing the patient to unproven risks without their full understanding. It also breaches the principle of non-maleficence by not adequately addressing potential harms. Another incorrect approach is to dismiss the patient's request and strictly adhere to the standard protocol without considering the biological rationale, even if the physician believes it might offer a marginal benefit. While adherence to standard protocols is generally best practice, a complete disregard for a biologically plausible rationale, especially when presented with a patient seeking personalized care, could be seen as a failure of beneficence if it means forgoing a potentially superior outcome without due consideration. This approach might also fail to uphold the spirit of personalized medicine, which is increasingly emphasized in European healthcare. A third incorrect approach is to unilaterally decide to offer the experimental modification without involving the patient in the decision-making process or seeking institutional review board, ERB, or ethics committee approval, if applicable under national regulations implementing EU guidelines on clinical trials or innovative treatments. This bypasses essential oversight mechanisms designed to protect patient safety and ensure ethical conduct, and it undermines patient autonomy by making a decision for them. Professional reasoning. Professionals should employ a structured decision-making process that begins with a thorough understanding of the patient's condition and the available evidence. This includes evaluating the biological rationale for any proposed deviation from standard care against established clinical guidelines and regulatory frameworks. The process must prioritize open and honest communication with the patient, ensuring they understand all options, risks, benefits, and uncertainties. When considering non-standard treatments, even those with a strong biological basis, the physician must assess the potential for harm and the necessity of obtaining appropriate ethical and regulatory approvals, if required. This framework ensures that decisions are patient-centered, ethically sound, and compliant with relevant European regulations governing healthcare and medical innovation. Question 8. The analysis reveals that a patient with a locally advanced squamous cell carcinoma of the head and neck is being considered for a hypofractionated radiotherapy regimen. The oncologist is weighing the potential for improved tumor control against the risk of increased xerostomia and dysphagia. Considering the biological implications of fractionation and the regulatory framework for radiotherapy practice, which of the following represents the most appropriate risk assessment approach? Option A. Conducting a thorough radiobiological assessment, considering the alpha-beta ratio of the tumor and critical organs at risk, to predict the impact of hypofractionation on both tumor control and normal tissue toxicity, and discussing these findings with the patient. Option B. Implementing a hypofractionated schedule based on the assumption that a higher biologically effective dose will universally lead to better outcomes, without detailed consideration of normal tissue constraints. Option C. Proceeding with a standard fractionation schedule, as it is the most widely accepted and carries the least regulatory risk, even if it may not be optimal for this specific patient's tumor biology. Option D. Adjusting the total dose and fraction size based on the patient's subjective tolerance to previous radiation treatments, prioritizing immediate comfort over long-term oncological efficacy. The correct answer is B. Implementing a hypofractionated schedule based on the assumption that a higher biologically effective dose will universally lead to better outcomes, without detailed consideration of normal tissue constraints. Explanation. The analysis reveals a scenario where a radiation oncologist is considering modifying a standard fractionation schedule for a patient with a specific clinical presentation. This is professionally challenging because it requires balancing established evidence-based protocols with individual patient needs, while strictly adhering to the European Board of Radiotherapy exam's regulatory framework, which emphasizes patient safety and efficacy. The decision-making process must be grounded in a thorough understanding of radiobiology and its implications for treatment outcomes and toxicity. The correct approach represents best professional practice because it prioritizes a systematic, evidence-informed risk assessment. This involves evaluating the potential benefits of altering fractionation, e.g., improved tumor control, reduced normal tissue complications, against the potential risks, all within the context of established radiobiological principles like the linear quadratic model and the concept of the alpha-beta ratio. This approach aligns with the ethical imperative to provide the best possible care, informed by scientific understanding and regulatory guidance that promotes patient well-being and adherence to quality standards. An incorrect approach that deviates from established radiobiological principles without a robust justification based on patient-specific factors or emerging evidence would represent a regulatory and ethical failure. For instance, arbitrarily reducing the dose per fraction without considering the potential for increased late toxicity due to a higher alpha-beta ratio in certain tissues, or increasing overall treatment time without accounting for tumor repopulation, would violate the principle of primum non nocere, first, do no harm, and could contravene guidelines promoting evidence-based practice. Similarly, making such modifications based solely on anecdotal experience or patient preference without a sound scientific rationale would be professionally unacceptable and ethically questionable. The professional decision-making process for similar situations should involve a structured risk-benefit analysis. This includes 1. Thoroughly reviewing the patient's clinical status, tumor characteristics, and previous treatments. 2. Consulting relevant radiobiological literature and established fractionation guidelines. 3. Considering the specific normal tissues at risk and their likely response to altered fractionation. 4. Discussing potential treatment modifications and their implications with the patient, ensuring informed consent. 5. Documenting the rationale for any deviation from standard practice, referencing supporting evidence or patient-specific factors. This systematic approach ensures that decisions are not only clinically sound, but also ethically defensible and compliant with regulatory expectations. Question 9. The audit findings indicate that the new treatment planning system, TPS, has been implemented for clinical use without comprehensive, independent end-to-end validation of its core dose calculation and optimization algorithms against established phantoms and benchmarked clinical data. The department relied primarily on the manufacturer's provided validation reports and a cursory review of the system's documentation. Which of the following approaches best reflects the required professional and regulatory standards for implementing a new TPS in a European radiotherapy setting? Option A. Proceed with clinical implementation after conducting independent, end-to-end validation of the TPS and its algorithms using appropriate phantoms and clinical data to ensure accuracy and safety, aligning with European regulatory requirements for medical devices and radiation protection. Option B. Continue using the TPS, but prioritize user training and implement additional checks at the point of patient treatment to mitigate any potential algorithmic inaccuracies, as the system has passed the manufacturer's internal quality checks. Option C. Immediately cease clinical use of the TPS and initiate a comprehensive revalidation process, as the reliance on manufacturer data alone and a superficial review is a significant deviation from regulatory mandates for independent verification and patient safety. Option D. Request the manufacturer to provide additional documentation and theoretical explanations of their algorithms, assuming that a deeper theoretical understanding will compensate for the lack of independent, practical validation. The correct answer is A. Proceed with clinical implementation after conducting independent, end-to-end validation of the TPS and its algorithms using appropriate phantoms and clinical data to ensure accuracy and safety, aligning with European regulatory requirements for medical devices and radiation protection. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a discrepancy between the theoretical capabilities of a treatment planning system, TPS, and its practical implementation and validation within a clinical setting. The challenge lies in ensuring that the chosen TPS and its underlying algorithms accurately reflect the intended clinical workflow and deliver safe, effective radiotherapy, as mandated by European regulatory frameworks governing medical devices and radiation protection. The need for rigorous validation and ongoing quality assurance is paramount to patient safety and compliance. Correct approach analysis. The correct approach emphasizes the critical importance of independent, end-to-end validation of the TPS and its algorithms against established phantoms and clinical data before routine clinical use. This aligns with the principles of good clinical practice, GCP, and the regulatory requirements for medical devices, which necessitate that systems are fit for purpose and perform as intended. European directives and guidelines, such as those related to medical device conformity and radiation protection, require that treatment planning systems are validated to ensure accuracy, reliability, and safety. This validation process confirms that the algorithms used for dose calculation and optimization are clinically acceptable, and that the system's output is consistent with established dosimetry standards and patient-specific needs. Incorrect approaches analysis. One incorrect approach involves relying solely on the manufacturer's preclinical validation data. This is a regulatory and ethical failure, because it abdicates the responsibility of the clinical institution to ensure the system's performance within its specific operational environment and patient population. Manufacturer's data, while important, does not account for site-specific factors, user variations, or the integration of the TPS into the broader clinical workflow. This approach risks non-compliance with regulations, requiring independent verification of medical device performance. Another incorrect approach is to proceed with clinical implementation based on a limited, superficial review of the TPS documentation without performing any independent validation. This represents a significant breach of professional duty and regulatory compliance. European regulations, particularly those concerning radiation protection and medical device safety, mandate a thorough understanding and verification of the tools used in patient treatment. A superficial review fails to identify potential algorithmic inaccuracies or system limitations that could compromise treatment efficacy and patient safety, leading to potential harm and regulatory sanctions. A third incorrect approach is to assume that a newer version of the TPS automatically guarantees improved accuracy and safety without revalidation. While software updates often aim for improvements, they can also introduce unintended consequences or regressions. Regulatory frameworks require that any changes to critical medical equipment, including TPS, undergo appropriate revalidation to ensure continued safety and efficacy. This approach risks implementing a system with unknown or unverified performance characteristics, violating the principle of due diligence and potentially exposing patients to suboptimal or unsafe treatments. Professional reasoning. Professionals should adopt a systematic decision-making framework that prioritizes patient safety and regulatory compliance. This involves 1. Understanding the regulatory landscape. Familiarize oneself with relevant European directives, national legislation, and professional guidelines pertaining to radiotherapy equipment and treatment planning. 2. Risk assessment. Identify potential risks associated with the implementation and use of the TPS, including algorithmic limitations, data integrity, and user error. 3. Due diligence. Conduct thorough due diligence on the TPS, including reviewing manufacturer specifications, independent research, and critically evaluating validation data. 4. Independent validation. Implement a robust, independent validation protocol using appropriate phantoms and clinical data to confirm the TPS's accuracy and reliability in the specific clinical context. 5. Quality assurance. Establish ongoing quality assurance procedures to monitor the TPS's performance and ensure continued compliance and safety. 6. Continuous learning. Stay abreast of advancements in TPS technology and evolving regulatory requirements. Question 10. System analysis indicates that when selecting between intensity-modulated radiation therapy (IMiT) and volumetric modulated arc therapy (VMAT) for a complex head and neck cancer case with critical structures in close proximity, what is the most appropriate professional approach to ensure optimal patient outcomes and regulatory compliance? Option A. Choose the technique that is most readily available within the department, regardless of its comparative efficacy for this specific clinical scenario. Option B. Prioritize the technique that offers the most conformal dose distribution and superior sparing of organs at risk, supported by robust clinical evidence and adherence to institutional quality assurance protocols. Option C. Implement the technique that has the most advanced technological features, as this inherently guarantees superior clinical results. Option D. Select the technique that the treating physician has the most extensive personal experience with, assuming it will lead to the most efficient treatment delivery. The correct answer is B. Prioritize the technique that offers the most conformal dose distribution and superior sparing of organs at risk, supported by robust clinical evidence and adherence to institutional quality assurance protocols. Explanation. The scenario presents a common challenge in advanced radiotherapy where the choice of delivery technique significantly impacts treatment efficacy and patient safety, necessitating a thorough understanding of the European Board of Radiotherapy exam's regulatory framework, which emphasizes evidence-based practice and patient-centric care. The correct approach, which involves a comprehensive review of clinical evidence, institutional protocols, and patient-specific factors, represents best professional practice because it aligns with the core principles of radiation oncology as guided by European directives and professional society recommendations. This approach ensures that the chosen technique, whether IMiT or VMAT, is not only technically feasible, but also demonstrably superior in terms of target coverage and organ at risk sparing for the specific clinical scenario, thereby maximizing therapeutic benefit while minimizing toxicity. Adherence to institutional quality assurance, CA programs and regulatory requirements for advanced technologies is paramount. Incorrect approaches fail to meet professional standards due to several regulatory and ethical shortcomings. Opting for a technique solely based on its perceived technological advancement, without robust clinical evidence or established QA procedures, violates the principle of evidence-based medicine and potentially exposes patients to undue risks. Similarly, prioritizing a technique due to familiarity or ease of implementation, without a rigorous comparative analysis against alternatives for the specific case, disregards the imperative to provide the optimal treatment. Failing to consult relevant clinical guidelines or institutional policies constitutes a breach of professional responsibility and regulatory compliance, as these frameworks are designed to ensure consistent, high-quality patient care. The professional decision-making process in such situations should involve a systematic evaluation. This includes 1. Defining the clinical question and patient-specific goals. 2. Conducting a thorough literature review of comparative studies for the chosen advanced technique. 3. Assessing the suitability of the technique based on tumor characteristics, surrounding anatomy, and dose constraints. 4. Evaluating the institution's technical capabilities and QA infrastructure. 5. Consulting with multidisciplinary teams. And 6. Documenting the rationale for the chosen technique, ensuring it aligns with regulatory expectations and ethical obligations to the patient. Question 11. During the evaluation of a complex intensity-modulated radiotherapy IMIT plan for a patient with a head and neck tumor, the medical physicist notes a minor discrepancy between the dose calculated by the treatment planning system, TPS, and the dose measured by an ionization chamber in a phantom at the isocenter. The discrepancy is within the acceptable tolerance range specified by the clinic's internal quality assurance (QA) protocol, but the physicist is aware that the TPS has recently undergone a software update. Considering the European Board of Radiotherapy exam's emphasis on robust dosimetry principles, what is the most appropriate course of action? Option A. Proceed with treatment as the measured dose is within the clinic's acceptable tolerance range, and the TPS update is unlikely to have introduced a significant error. Option B. Rely solely on the TPS calculated dose, as it is a sophisticated system designed for accurate dose calculation, and the phantom measurement is a secondary check. Option C. Adjust the TPS parameters to match the measured dose, assuming the measurement is more accurate than the TPS calculation. Option D. Perform an independent dose verification using a different dosimetry system or method and investigate the cause of the discrepancy, especially in light of the recent TPS software update, before proceeding with treatment. The correct answer is A. Proceed with treatment as the measured dose is within the clinic's acceptable tolerance range, and the TPS update is unlikely to have introduced a significant error. Explanation. This scenario presents a professional challenge because it requires the radiotherapist to balance the immediate need for treatment delivery with the fundamental principles of accurate dosimetry and patient safety, all within the strict regulatory framework governing radiotherapy in Europe. The core of the challenge lies in ensuring that any deviation from established protocols, even if seemingly minor or intended to expedite treatment, does not compromise the precision of the radiation dose delivered to the target volume and critical organs. This requires a deep understanding of the underlying physics and the potential consequences of altered measurement techniques. The correct approach represents best professional practice because it prioritizes adherence to the European Board of Radiotherapy's guidelines on dosimetry, which are designed to ensure consistency, accuracy, and patient safety across member states. Specifically, it emphasizes verification of the treatment planning system's output using independent, calibrated measurement devices that are traceable to national standards. This independent verification is a cornerstone of quality assurance in radiotherapy, mandated by regulatory bodies to minimize the risk of under- or overdosing. It ensures that the dose calculated by the TPS accurately reflects the dose delivered at the patient's position, thereby upholding the ethical obligation to provide safe and effective treatment. An incorrect approach that involves relying solely on the treatment planning system's calculated dose, without independent verification, fails to meet the stringent quality assurance requirements. This is a direct violation of the principles of good clinical practice and regulatory mandates that require independent checks of dose delivery. Such an approach introduces an unacceptable risk of systematic errors, potentially leading to suboptimal tumor control or increased toxicity. Another incorrect approach, such as using a non-calibrated or outdated measurement device, compromises the accuracy of the verification process. The calibration of dosimetry equipment is a critical regulatory requirement to ensure that measurements are reliable and comparable, and using uncalibrated equipment is a significant ethical and regulatory failure, as it undermines the integrity of the entire quality assurance chain. Professionals should employ a decision-making framework that begins with a thorough understanding of the relevant European regulations and guidelines for radiotherapy quality assurance. This framework involves identifying the specific dosimetry principles and techniques required for the treatment modality. When faced with a discrepancy or a need for verification, the professional must consult established protocols for independent dose verification. This includes selecting appropriate, calibrated measurement equipment and performing measurements according to standardized procedures. Any deviations from expected results must be investigated thoroughly, involving a multidisciplinary team if necessary, before treatment proceeds. The ultimate decision to proceed with treatment must be based on a documented assurance that the delivered dose will be accurate and safe, in full compliance with regulatory standards. Question 12. Benchmark analysis indicates that a significant number of radiotherapy departments are experiencing minor couch misalignments during patient setup, leading to potential inaccuracies in dose delivery. In a specific instance, during the initial setup for a patient's treatment fraction, the radiation therapist identifies a 3 mm discrepancy between the planned couch position and the actual couch position, as indicated by the treatment planning system's reference markers. The patient is already positioned on the couch. Considering the European Board of Radiotherapy exam's emphasis on patient safety protocols and regulatory compliance, what is the most appropriate immediate course of action? Option A. Immediately halt the treatment delivery and initiate a full investigation into the cause of the misalignment before proceeding. Option B. Proceed with the treatment, assuming the 3 mm deviation is within acceptable tolerance and will not significantly impact the treatment outcome. Option C. Document the 3 mm deviation in the patient's record and proceed with treatment, as the deviation will be accounted for in subsequent fractions. Option D. Resume treatment after a brief visual check, as the patient is already in position and the deviation is minor. Correct answer is A. Immediately halt the treatment delivery and initiate a full investigation into the cause of the misalignment before proceeding. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in radiotherapy, ensuring patient safety during a complex treatment delivery where a deviation from the prescribed plan is identified. The professional challenge lies in balancing the immediate need to protect the patient from potential harm with the imperative to deliver the intended therapeutic dose. The identified deviation, a misalignment of the patient couch, directly impacts the accuracy of radiation delivery, potentially leading to undertreatment of the target volume or overtreatment of organs at risk. This requires immediate, decisive, and well-justified action based on established protocols and professional judgment. Correct approach analysis. The correct approach prioritizes patient safety by immediately halting treatment and initiating a thorough investigation. This aligns with fundamental principles of radiation protection and patient care, as enshrined in European guidelines and national regulations governing medical radiation practices. Specifically, it reflects the principle of as low as reasonably achievable (ALARA) for radiation exposure and the ethical obligation to avoid harm. The immediate cessation of treatment prevents further delivery of radiation based on an inaccurate setup, thereby minimizing the risk of adverse events. The subsequent investigation ensures that the root cause of the misalignment is identified and addressed, preventing recurrence and maintaining the integrity of the treatment process. This systematic approach is mandated by quality assurance frameworks that emphasize continuous monitoring and incident reporting. Incorrect approaches analysis. One incorrect approach involves proceeding with treatment despite the identified couch misalignment, assuming the deviation is minor and unlikely to cause significant harm. This is a grave regulatory and ethical failure. It violates the principle of do no harm and disregards the established tolerance limits for treatment delivery accuracy. Such an action bypasses critical safety checks and quality assurance procedures, potentially leading to suboptimal treatment outcomes, increased toxicity, and a breach of professional responsibility. It also undermines the trust placed in healthcare professionals by patients and regulatory bodies. Another incorrect approach is to resume treatment without a proper investigation into the cause of the misalignment. While it might seem efficient to quickly restart, this fails to address the underlying issue. This represents a failure in the quality management system and a disregard for preventative measures. Without understanding why the misalignment occurred, the risk of it happening again remains high, jeopardizing future treatments. This approach neglects the systematic approach to error management and continuous improvement expected in a regulated healthcare environment. A third incorrect approach is to only document the deviation without taking immediate action to correct it or halt treatment. Documentation is crucial for incident reporting and analysis, but it is insufficient as a standalone measure when patient safety is compromised. This approach fails to act proactively to prevent harm, which is a primary ethical and regulatory requirement. The documentation alone does not mitigate the immediate risk to the patient, making it an inadequate response to a critical safety concern. Professional reasoning. Professionals facing such a situation must employ a structured decision-making process. This begins with immediate risk assessment. Is the deviation likely to cause harm? If yes, the priority is to stop the procedure. Next, follow established protocols for incident management, which typically involve halting treatment, documenting the event, investigating the cause, and implementing corrective actions. This process should be guided by the institution's quality assurance program and relevant European directives and national legislation concerning radiation protection and patient safety. Open communication with the patient and the multidisciplinary team is also essential. Question 13. Operational review demonstrates that a new, faster radiotherapy treatment delivery technique has been introduced, potentially increasing patient throughput. Which of the following represents the most appropriate and safest approach to integrate this new technique into clinical practice? Option A. Proceed with the new technique immediately, assuming existing safety protocols are sufficient due to the increased efficiency, and address any emergent safety issues as they arise. Option B. Conduct a comprehensive risk assessment specific to the new technique, update existing safety protocols accordingly, and ensure all staff receive adequate training on the revised procedures and potential new safety considerations. Option C. Rely solely on the manufacturer's safety documentation for the new equipment and technique, without conducting an independent departmental risk assessment or modifying existing protocols. Option D. Implement the new technique after a brief discussion among senior staff, with the understanding that any staff member can raise concerns if they feel unsafe, without formal documentation or procedural changes. The correct answer is B. Conduct a comprehensive risk assessment specific to the new technique, update existing safety protocols accordingly, and ensure all staff receive adequate training on the revised procedures and potential new safety considerations. Explanation. Scenario analysis. This scenario presents a common challenge in radiotherapy departments, balancing the need for efficient patient throughput with the paramount importance of radiation safety. The introduction of a new, faster treatment technique, while potentially beneficial for patient care and resource utilization, necessitates a rigorous reevaluation of existing safety protocols. The professional challenge lies in identifying potential new risks introduced by the faster delivery, ensuring that established safety principles are not compromised, and that staff are adequately trained and equipped to manage these changes. A hasty implementation without thorough safety assessment could lead to increased radiation exposure to staff or patients, or even equipment malfunction due to unforeseen operational demands. Correct approach analysis. The correct approach involves a comprehensive, multifaceted review that prioritizes patient and staff safety above all else. This aligns with the fundamental principles of radiation protection, as enshrined in European directives and national legislation governing medical exposures. Specifically, it reflects the ALARA as low as reasonably achievable principle, which mandates minimizing radiation doses while still achieving the intended diagnostic or therapeutic benefit. A thorough risk assessment, including potential changes in scatter radiation, beam alignment, and emergency procedures, is crucial. Furthermore, ensuring adequate staff training on the new technique and its associated safety implications, along with verification of the integrity and safety features of the new equipment, are non-negotiable steps. This proactive and systematic approach ensures that the benefits of the new technology are realized without compromising the safety culture and regulatory compliance of the department. Incorrect approaches analysis. Implementing the new technique without a formal risk assessment and updated safety protocols is a significant regulatory and ethical failure. Directly contravenes the ALARA principle and the legal obligation to protect workers and the public from ionizing radiation. This approach prioritizes efficiency over safety, which is unacceptable in a healthcare setting. Relying solely on the manufacturer's assurances regarding safety without independent verification and departmental adaptation is also a failure. While manufacturers provide safety specifications, the specific operational environment and workflow of a department can introduce unique risks that require local assessment and mitigation. This approach abdicates the department's responsibility for ensuring safety within its own context, assuming that existing safety protocols are sufficient simply because the new technique is faster is a dangerous assumption. Speed of delivery does not inherently equate to safety. It can, in fact, introduce new safety considerations related to the pace of operations, potential for errors, and the need for rapid decision-making under pressure. This approach neglects the principle of continuous improvement and vigilance in radiation safety. Professional reasoning. Professionals in radiotherapy must adopt a decision-making process rooted in a strong safety culture and adherence to regulatory frameworks. When introducing new technologies or techniques, the process should involve 1. Proactive identification of potential hazards and risks associated with the change. 2. Thorough risk assessment, considering all aspects of patient and staff exposure. 3. Development and implementation of appropriate control measures and updated safety protocols. 4. Comprehensive training and competency assessment for all affected personnel. 5. Regular monitoring and review of the effectiveness of implemented safety measures. This systematic and safety-first approach ensures that innovation in radiotherapy is pursued responsibly and ethically, upholding the highest standards of patient and staff protection. Question 14. Regulatory review indicates that a patient undergoing radiotherapy for a pelvic malignancy has demonstrated significant anatomical changes due to tumor shrinkage and weight loss, necessitating a potential adjustment to their treatment plan. The radiation oncologist receives a report from the radiologist highlighting these changes and suggesting a revised beam arrangement. What is the most appropriate course of action to ensure patient safety and regulatory compliance? Option A. Initiate the revised beam arrangement immediately based on the radiologist's recommendation, as the changes are clearly documented and clinically relevant. Option B. Continue with the original treatment plan, as the administrative burden of replanning and re-verification for adaptive radiotherapy is too high given the patient's current status. Option C. Inform the patient of the anatomical changes and ask for their consent to proceed with the original plan while awaiting further guidance from the medical physics department. Option D. Proceed with a formal multidisciplinary team review of the proposed adaptation, ensuring it aligns with institutional quality assurance protocols for adaptive radiotherapy before implementation. The correct answer is A. Initiate the revised beam arrangement immediately based on the radiologist's recommendation, as the changes are clearly documented and clinically relevant. Explanation. The scenario presents a common challenge in adaptive radiotherapy, balancing the potential benefits of real-time treatment adjustments with the need for robust quality assurance and regulatory compliance. The professional challenge lies in ensuring that any deviation from the initial treatment plan, even if based on updated imaging, is systematically evaluated, documented, and approved according to established protocols and regulatory requirements. This requires a deep understanding of the European Board of Radiotherapy exam's guidelines on adaptive radiotherapy, which emphasize patient safety, efficacy, and the integrity of the treatment process. The correct approach represents best professional practice because it prioritizes a structured, evidence-based decision-making process. It involves a multidisciplinary team review, which is a cornerstone of safe and effective radiotherapy practice. This review ensures that the proposed adaptation is clinically justified, technically feasible, and aligns with the patient's overall treatment goals. Crucially, it mandates adherence to the institution's quality assurance protocols for adaptive radiotherapy, ensuring that the adaptation is implemented with the same rigor as the initial plan. This aligns with regulatory expectations for maintaining high standards of care and minimizing risks associated with treatment modifications. An incorrect approach that involves immediate implementation of an adaptation based solely on a radiologist's recommendation, without a formal multidisciplinary review or adherence to QA protocols, represents a significant regulatory and ethical failure. It bypasses essential safety checks, potentially leading to unintended consequences for the patient. It violates the principle of due diligence and the requirement for documented, approved treatment changes. Another incorrect approach, which is to disregard the need for adaptation despite clear anatomical changes, fails to optimize treatment delivery and may compromise therapeutic outcomes, potentially falling short of the standard of care expected under European regulations. Finally, an approach that delays adaptation due to administrative burden, without a clear process for expedited review of critical changes, also poses a risk to patient care and regulatory compliance by not acting in a timely manner when clinically indicated. The professional decision-making process for similar situations should involve a clear understanding of the institution's adaptive radiotherapy protocol. When a potential need for adaptation arises, the first step is to assess the clinical significance of the observed changes. This should be followed by consultation with the relevant multidisciplinary team members, radiation oncologist, medical physicist, radiographer. If adaptation is deemed necessary, the process must then follow the established QA procedures for plan modification, including verification and approval before implementation. Documentation at each stage is paramount for regulatory compliance and continuity of care. Question 15. Governance review demonstrates that a European radiotherapy center has acquired a novel imaging technology intended to improve treatment planning accuracy. The Clinical Physics Department is tasked with integrating this technology into the existing quality assurance (QA) framework. Which of the following represents the most appropriate and regulatory compliant approach to ensure the safe and effective implementation of this new technology? Option A. Defer the implementation of the new imaging technology until a significant body of independent peer-reviewed literature confirms its long-term benefits and safety profile, even if it means delaying potential patient care improvements. Option B. Integrate the new imaging technology into the QA framework by performing only basic functional checks, assuming that its advanced nature inherently guarantees its accuracy and reliability. Option C. Conduct a comprehensive independent validation of the new imaging technology's performance against established benchmarks and adapt existing QA protocols to encompass its specific characteristics and potential failure modes before widespread clinical use. Option D. Implement the new imaging technology immediately into clinical practice, relying on the vendor's standard QA procedures to ensure its performance and safety. The correct answer is D. Implement the new imaging technology immediately into clinical practice, relying on the vendor's standard QA procedures to ensure its performance and safety. Explanation: scenario analysis. This scenario presents a common challenge in radiotherapy quality assurance (QA), where a new technology, while promising improved patient outcomes, introduces novel complexities and potential risks. The professional challenge lies in balancing the adoption of innovation with the imperative to ensure patient safety and treatment efficacy, all within the strict regulatory framework governing radiotherapy in Europe. The need for rigorous validation and adaptation of existing QA protocols is paramount, requiring a deep understanding of both the technology and the regulatory expectations. Correct approach analysis. The correct approach prioritizes a systematic, evidence-based validation of the new technology's impact on the entire radiotherapy workflow, from imaging to treatment delivery and verification. This aligns with the European Board of Radiotherapy's emphasis on robust quality management systems, which are mandated by directives such as the Council Directive 2013/59/EURATOM, laying down basic safety standards for protection against the dangers arising from exposure to ionizing radiation. This approach ensures that any new technology is integrated safely and effectively, with established protocols to mitigate risks and confirm intended benefits. It reflects best professional practice by adhering to a principle of due diligence, ensuring that patient care is not compromised by unproven or inadequately assessed technological advancements. Incorrect approaches analysis. One incorrect approach involves immediate and widespread adoption of the new technology without comprehensive validation. This represents a significant regulatory failure, as it bypasses the requirement for thorough risk assessment and protocol adaptation mandated by European radiation protection legislation. Ethically, it exposes patients to potential harm from an unverified system. Another incorrect approach is to dismiss the technology entirely due to perceived complexity or lack of immediate familiarity. This is professionally unsound, as it stifles innovation that could benefit patients and fails to engage with the evolving landscape of radiotherapy. It may also contravene the spirit of continuous improvement inherent in quality assurance frameworks. A third incorrect approach is to rely solely on vendor-provided QA protocols without independent verification. While vendor input is valuable, regulatory frameworks and professional ethics demand independent oversight and validation to ensure that the QA measures are adequate for the specific clinical context and meet the stringent standards of European regulatory bodies. This approach risks overlooking site-specific issues or limitations in the vendor's testing. Professional reasoning. Professionals should adopt a structured decision-making process that begins with understanding the regulatory landscape and the specific requirements for introducing new technologies. This involves a thorough literature review, consultation with experts, and a phased implementation plan. The process should include risk assessment, development and validation of new QA protocols, staff training, and a period of close monitoring and evaluation. This systematic approach ensures that patient safety and treatment quality are maintained or enhanced, aligning with both regulatory mandates and ethical obligations. Question 16. The risk matrix shows a moderate likelihood of treatment delivery errors due to variations in patient positioning during IGIT, coupled with a high potential impact on patient outcomes. Which of the following actions is the most appropriate response to mitigate this identified risk? Option A. Conduct a comprehensive review of existing IGIT implementation protocols and enhance staff training on patient immobilization and image acquisition techniques. Option B. Immediately halt all IGIT procedures until a new, more expensive IGIT system can be procured. Option C. Increase the frequency of IGIT image acquisition for all patients undergoing radiotherapy without altering current protocols or training. Option D. Postpone any further investment in IGIT technology and rely on standard imaging techniques until a significant incident occurs. Correct answer is A. Conduct a comprehensive review of existing IGIT implementation protocols and enhance staff training on patient immobilization and image acquisition techniques. Explanation. The scenario presents a common challenge in modern radiotherapy departments, balancing the adoption of advanced technologies like IGIT with the need to ensure patient safety and efficient resource allocation. The professional challenge lies in interpreting the implications of a risk matrix, which quantifies potential hazards, and translating these insights into actionable strategies that align with regulatory expectations and ethical obligations. The European Board of Radiotherapy exam emphasizes a commitment to patient-centered care, which necessitates a proactive approach to risk management. The correct approach, focusing on a comprehensive review of IGIT implementation protocols and staff training, represents best professional practice because it directly addresses the identified risks at their source. European regulatory frameworks, such as those guiding the safe use of medical devices and radiation protection, mandate that healthcare providers implement robust quality assurance programs. This includes ensuring that all personnel involved in IGIT procedures are adequately trained and that established protocols are followed meticulously. Such an approach minimizes the likelihood of errors, optimizes treatment delivery, and ensures compliance with standards for patient safety and efficacy. An incorrect approach that prioritizes immediate cost reduction by limiting IGIT system upgrades without a thorough risk assessment fails to acknowledge the potential for increased patient harm or suboptimal treatment outcomes. This would be a direct contravention of radiation protection principles and quality management directives, which require continuous improvement and investment in technologies that enhance safety and efficacy. Another incorrect approach, focusing solely on increasing the frequency of IGIT without evaluating the underlying protocols or staff competency, could lead to unnecessary radiation exposure for patients and staff, and inefficient use of resources, without necessarily mitigating the identified risks effectively. This overlooks the importance of a systematic and evidence-based approach to risk management. A further incorrect approach, such as deferring staff training until after a significant incident, demonstrates a reactive rather than proactive stance on patient safety, which is ethically unacceptable and likely to violate regulatory requirements for ongoing professional development and risk mitigation. The professional decision-making process in such situations should involve a systematic evaluation of the risk matrix, followed by a multidisciplinary discussion involving radiation oncologists, medical physicists, radiographers, and quality assurance personnel. This team should collaboratively assess the identified risks, consider the available evidence on IGIT best practices, and develop a prioritized action plan that addresses the most critical risks first, while also considering resource implications and regulatory compliance. The focus should always be on patient safety, treatment efficacy, and continuous quality improvement. Question 17. Implementation of a radiotherapy treatment plan for a patient with a high risk of developing severe late toxicity requires a thorough understanding of how cellular mechanisms influence radiation response. Which of the following approaches best reflects a comprehensive impact assessment of radiation-induced damage repair in this context? Option A. Relying on anecdotal evidence and historical patient data without considering the underlying radiobiological mechanisms of DNA repair. Option B. Evaluating patient-specific factors known to modulate DNA repair pathways and their potential impact on both tumor control and normal tissue complication probability, and adjusting treatment parameters accordingly. Option C. Focusing exclusively on the immediate tumor response and neglecting the long-term implications of cellular damage and repair in healthy tissues. Option D. Prioritizing dose escalation to the tumor based on standard fractionation schedules, assuming uniform DNA repair capacity across all patients. The correct answer is D. Prioritizing dose escalation to the tumor based on standard fractionation schedules, assuming uniform DNA repair capacity across all patients. Explanation: the scenario presents a professional challenge due to the inherent complexity of radiation-induced DNA damage repair mechanisms and the potential for interindividual variability in response to radiotherapy. Clinicians must balance the therapeutic benefits of radiation with the risk of long-term sequelae, which are directly linked to the efficiency of cellular repair processes. The European Board of Radiotherapy exam emphasizes a deep understanding of these biological underpinnings to ensure optimal patient outcomes and adherence to best practices in radiation oncology. The correct approach represents best professional practice because it acknowledges the current scientific understanding of DNA repair pathways and their influence on radiation response and toxicity. By considering patient-specific factors that might modulate these repair mechanisms, clinicians can tailor treatment strategies to minimize damage to healthy tissues while effectively targeting the tumor. This aligns with the European regulatory framework's emphasis on personalized medicine and the principle of ALARA, as low as reasonably achievable, for radiation exposure to normal tissues. It promotes a proactive, evidence-based approach to managing potential long-term effects, thereby enhancing patient safety and quality of life. An incorrect approach that focuses solely on the immediate tumor response without considering the underlying repair mechanisms fails to address the long-term implications of radiation damage. This could lead to underestimation of potential late toxicities and suboptimal patient management. Ethically, it neglects the duty of care to minimize harm. Another incorrect approach that relies on outdated or unvalidated biomarkers for predicting repair capacity would be professionally unacceptable, as it deviates from evidence-based practice and could lead to inappropriate treatment decisions. This violates the principle of using validated scientific knowledge in clinical practice. A third incorrect approach that dismisses the role of DNA repair entirely in determining treatment outcomes would be a significant failure to understand fundamental radiobiology, leading to a potentially less effective and more harmful treatment plan. This demonstrates a lack of critical engagement with the scientific basis of radiotherapy. Professional decision-making in such situations requires a systematic process. First, thoroughly assessing the available scientific literature on DNA repair and its clinical relevance. Second, evaluating patient-specific factors that might influence repair, e.g., genetic predispositions, comorbidities. Third, integrating this information into treatment planning to optimize dose distribution and fractionation. And finally, establishing robust follow-up protocols to monitor for and manage any radiation-induced damage. This iterative process ensures that treatment decisions are informed, patient-centered, and aligned with regulatory and ethical standards. Question 18. The performance metrics show that a portable ionization chamber exhibits excellent energy independence across the therapeutic beam energies used in the clinic, while a solid-state detector demonstrates superior spatial resolution, but a noticeable energy dependence at lower photon energies. For verifying the delivered dose to a specific small target volume within a patient, which detector's performance characteristics are most critical for ensuring accurate and safe treatment delivery according to European radiotherapy standards? Option A. The ionization chamber's excellent energy independence, as accurate dose calibration across all beam energies is paramount for patient safety. Option B. the solid-state detector's energy dependence, as this characteristic must be accounted for in any dose calculation. Option C, the ionization chamber's portability, as it allows for more frequent and convenient in vivo dosimetry. Option D, the solid-state detector's superior spatial resolution, as precise targeting of small volumes is the primary concern for treatment efficacy. The correct answer is A, the ionization chamber's excellent energy independence, as accurate dose calibration across all beam energies is paramount for patient safety. Explanation: this scenario presents a professional challenge because it requires the radiotherapist to interpret and act upon performance metrics from different radiation detection and measurement devices, each with inherent characteristics and limitations. The challenge lies in selecting the most appropriate device for a specific clinical task, ensuring patient safety and treatment accuracy, while adhering to the stringent regulatory framework of the European Board of Radiotherapy exam. Careful judgment is required to avoid misinterpreting data, which could lead to suboptimal treatment delivery or unnecessary patient exposure. The correct approach represents best professional practice because it prioritizes the fundamental principles of radiation protection and quality assurance as mandated by European guidelines for radiotherapy. It involves understanding the specific application, e.g., patient dosimetry, environmental monitoring, and selecting a detector whose characteristics, e.g., energy response, sensitivity, spatial resolution, are best suited for that application, thereby ensuring the most accurate and reliable measurements. This aligns with the regulatory requirement to use calibrated and appropriate equipment for all aspects of radiation therapy. An incorrect approach would be to assume all detectors are interchangeable or to select a detector based solely on convenience or availability without considering its suitability for the task. This could lead to inaccurate dose measurements, compromising treatment efficacy and patient safety. For instance, using a detector with poor energy dependence for patient dosimetry could result in significant under- or overdosing. Ethically, this failure to ensure accurate measurement directly violates the duty of care owed to the patient. Regulatory failure would stem from noncompliance with quality assurance protocols that mandate the use of validated and appropriate measurement devices. Another incorrect approach might be to rely on a detector with insufficient sensitivity for low-dose rate measurements, leading to a failure to detect potentially harmful stray radiation or to accurately verify low-dose prescriptions. Professional decision-making in such situations should involve a systematic process. First, clearly define the measurement objective. Second, review the technical specifications and performance characteristics of available detectors. Third, consult relevant European guidelines and institutional quality assurance protocols to determine the most appropriate detector type and calibration requirements for the specific task. Finally, document the rationale for the chosen detector and ensure its proper calibration and ongoing quality control. Question 19. The monitoring system demonstrates a consistent energy deposition pattern within the treatment area, characterized by the ability to directly alter molecular structures and cause ionization in biological tissues. This pattern is distinct from electromagnetic waves that primarily interact through thermal effects. Based on this observation and the principles of radiation protection as defined by European regulations, which classification of radiation is most accurately represented? Option A, non-ionizing radiation. Option B, thermal radiation. Option C, ionizing radiation. Option D, electromagnetic radiation. Correct answer is C, ionizing radiation. Explanation: this scenario is professionally challenging because it requires the radiation protection officer to accurately distinguish between different types of radiation based on their interaction with biological tissues and their regulatory classification, even when presented with potentially ambiguous monitoring data. The core of the challenge lies in applying the correct regulatory framework for each type of radiation, as the European Board of Radiotherapy exam mandates strict adherence to European Union directives and relevant national legislation concerning radiation protection. The correct approach represents best professional practice because it prioritizes patient and staff safety by correctly identifying the nature of the radiation and implementing the appropriate protective measures and regulatory oversight. This aligns with the fundamental principles of radiation protection, which are enshrined in EU legislation such as Directive 2013/59/Euratom. This directive establishes basic safety standards for the protection of health against the dangers arising from exposure to ionizing radiation. Correctly identifying ionizing radiation necessitates adherence to stringent dose limits, monitoring requirements, and safety protocols for its use in radiotherapy. An incorrect approach that misclassifies ionizing radiation as non-ionizing would be a significant regulatory and ethical failure. This would lead to inadequate safety measures, potentially exposing individuals to harmful levels of radiation without proper controls, thereby violating the principles of justification, optimization, and dose limitation. Conversely, misclassifying non-ionizing radiation as ionizing would lead to unnecessary alarm, overregulation, and potentially hinder the beneficial use of technologies that emit non-ionizing radiation, such as certain imaging modalities or therapeutic devices, without a clear regulatory basis for such stringent controls. The failure here is in understanding the distinct regulatory frameworks and hazard profiles associated with each radiation type. The professional decision-making process should involve a systematic review of the monitoring data, cross-referencing it with known characteristics of different radiation types. This requires a thorough understanding of the physical properties of ionizing radiation, e.g., its ability to cause ionization in matter, its biological effects at cellular level, and non-ionizing radiation, e.g., its electromagnetic spectrum, its primary interaction mechanisms like heating. The professional must then consult the relevant European and national regulations to determine the appropriate classification, safety protocols, and reporting requirements for the identified radiation type. If there is any ambiguity, seeking expert advice or consulting detailed technical specifications of the equipment is crucial. Question 20. The risk matrix shows a range of potential adverse events associated with a particular radiotherapy treatment, with varying probabilities and severities. Considering the European Board of Radiotherapy examines emphasis on evidence-based practice and patient safety, which of the following approaches best reflects the principles of treatment planning in this context? Option A. Conduct a multidisciplinary team discussion to review the patient's specific clinical data, interpret the risk matrix in conjunction with current evidence, and formulate a personalized treatment plan. Option B. Solely rely on the judgment of the most senior radiation oncologist in the department to determine the appropriate treatment, irrespective of the risk matrix or input from other team members. Option C. Implement the treatment option corresponding to the highest risk score on the matrix, assuming that the potential benefits outweigh the identified risks as indicated by the matrix. Option D. Prioritize the treatment option that aligns with the lowest risk score on the matrix, aiming to minimize any potential for side effects, even if it means a reduced chance of disease control. The correct answer is D. Prioritize the treatment option that aligns with the lowest risk score on the matrix, aiming to minimize any potential for side effects, even if it means a reduced chance of disease control. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from the inherent uncertainty in predicting patient response to radiotherapy and the ethical imperative to provide the best possible care within resource constraints. The risk matrix highlights potential adverse events and their likelihood, but translating this into a definitive treatment plan requires balancing potential benefits against potential harms, considering individual patient factors, and adhering to established clinical guidelines and regulatory expectations for quality and safety in radiotherapy. The challenge lies in making a judgment call that is both clinically sound and ethically defensible, especially when faced with differing expert opinions or evolving evidence. Correct approach analysis. The correct approach emphasizes a multidisciplinary team, MDT discussion to review the patient's specific case, including imaging, pathology, and any relevant comorbidities, in conjunction with the risk matrix. This aligns with the European Board of Radiotherapy's emphasis on evidence-based practice and patient-centered care. The MDT, comprising radiation oncologists, medical physicists, radiographers, and potentially other specialists, can collectively interpret the risk matrix in the context of the individual patient's unique circumstances and the latest clinical evidence. This collaborative approach ensures that the treatment plan is not solely dictated by a statistical tool, but is a considered decision that optimizes efficacy while minimizing toxicity, in line with regulatory requirements for safe and effective radiotherapy delivery. The process also implicitly involves considering the patient's informed consent, a cornerstone of ethical medical practice. Incorrect approach is analysis. Adhering strictly to the highest risk score on the matrix without further clinical consideration is an oversimplification. This approach fails to account for individual patient variability, potential for overtreatment, and the possibility that the risk matrix may not perfectly capture all relevant factors for this specific patient. Represents a failure to apply clinical judgment and a potential breach of the duty of care to provide individualized treatment. Choosing the lowest risk score to minimize potential side effects, irrespective of the potential for treatment failure, is also professionally unacceptable. This approach prioritizes avoiding harm to the detriment of achieving therapeutic benefit, potentially leading to suboptimal outcomes and a failure to meet the patient's clinical needs. It disregards the fundamental principle of radiotherapy, which is to control or eradicate disease, and may violate regulatory expectations for effective cancer treatment. Relying solely on the opinion of the most senior clinician without engaging the broader MDT risks, introducing bias, and overlooking valuable insights from other team members. While senior expertise is crucial, a comprehensive MDT review ensures a more robust and balanced decision-making process, which is implicitly expected in high-quality radiotherapy services. This approach could lead to a less optimal plan and potentially fail to meet the standards of care expected by regulatory bodies. Professional reasoning. Professionals should approach such situations by first understanding the limitations of any risk assessment tool. The risk matrix is a guide, not a definitive directive. The decision-making process should involve 1. Thorough review of all available clinical data for the patient. 2. Collaborative discussion within the MDT, integrating the risk matrix findings with clinical expertise and patient-specific factors. 3. Consideration of the latest evidence-based guidelines. 4. Open communication with the patient regarding treatment options, risks, and benefits to facilitate informed consent. This systematic and collaborative approach ensures that treatment planning is both clinically appropriate and ethically sound, meeting the high standards expected in European radiotherapy practice.